Great.
All right. Well, I'll keep an eye on the waiting room here because I know that we should be getting probably about 2 to 3 more people to join. So, but good afternoon, everyone. Thanks to all of you for joining us on our kickoff meeting of the CDC Arthritis Grant project. I think many of us are very excited to get this work started. I know for sure Greg and I are. And Deb on our team. We are going to put a hold right now just for a moment on introductions because we actually have a spot for that on our agenda specifically, and we'll give time for people to share at that when we get to that point. And then in just a moment, we will give a quick overview of the CDC grant and then go into more details about our efforts in Iowa. Greg will summarize our plan, and then we will have discussions about how we operationalize the plan. And hopefully we'll get some good discussions with all of you. And then I just want to mention that I'm excited about this because so much of this project specifically really lays that groundwork for supporting so many more programs and services, and hopefully frames how we as partners collaborate on important health issues and health initiatives moving forward. So we're really, really excited about this. And so, Greg, I think with that, I will turn it over to you.
Sure. Yep. I'm going to extend my welcome as well. So Trina and I have been working on this type of concept and grant for a long time, and this one hit, and I think it's only the first of many. So the kudos go to Trina for setting up the hub and enabling this type of statewide partnership, and that's one of the reasons I think our project was funded. So I thought I'd walk through a little bit about what this grant looks like. So one of the synergies that really worked well is the ISU is used to this type of grant and being able to submit paperwork and budgets, but we again couldn't have done this without having a hub in place. So Trina and I are really kind of tag teaming on this and are kind of acting as co-PIs of the project. So ISU will handle all the paperwork and the submission and the budgets and things, but Trina and the hub are really the drivers of what we're doing. And it's really a capacity building project. So I wanted to emphasize that from the beginning, that this is not a research grant. The CDC has funded this as it's called a program project grant, and it's not intended for research. In fact, they specifically say we're not supposed to do research. We will still do evaluation, and they actually put a strong emphasis on that in the project. And so we're required to adhere to certain outcome measures and to track them and to do really good quality control over time. But again, I want to emphasize it's not a research grant. This is a public health capacity building project. And so they title it a program project grant, and it's 5 years. And the great thing about this is, well, there's an annual review and renewal every year. So we're not really guaranteed every year of funding. We have to deliver. So we have to show that we're on track, making good progress, that we have an engaged team, that we're really tracking things. And the great news is we're already well positioned to do this. And so our project was scored very highly. I think we were like, what was it, 98%, Trina? So the reviewers really liked everything that we had in the project. And there is strong CDC oversight. So that was my third point here. We meet monthly with the CDC team, and there's like 2 or 3 other researchers that are in the arthritis branch that are guiding our work. And so every month we have to show them kind of our progress and what we're doing. And that includes tracking and reporting of our outcome measures and performance measures. And so I'll get to those in a little bit, but the CDC team is there also for oversight and guidance. So they know that we can't really do this on our own. And so it's fair for us to ask questions and share, what's working and not working. So we'll be very transparent with them, just like we'll be very transparent with all of you about how this project works. And that's one of our goals of the meeting, really, is to make sure that in pulling this together, that the project is consistent with work that all of you are doing or that you're passionate about, or that it's building capacity across the state in whatever group you work with. And so we really want to make an impact here. So this is, again, a public health initiative. And one of our requirements that we'll get to is we need to enroll 6,500 people in arthritis appropriate evidence-based interventions by year 5. And so we won't get there right away, but the goal is to incrementally get more awareness, more enrollment, and more engagement of people in arthritis appropriate evidence-based interventions. And so all of you have a role to play here, and we're excited to outline that for you. And this is just a kickoff meeting. We'll explain how we kind of envision breaking this down and working with all of you on your individual roles and seeing how that works. The other piece here that we want to talk about is Trina and I both work really closely now with this group called the National Association for Chronic Disease Directors, NACDD, and they are actually funded by the CDC to do their work. And so their work is aimed at helping states and entities and public health departments build their capacity to deliver programs. And they have a really strong network that they've created, and they're really effective in building capacity in our team. And then our goal would be to share that back with you. So Trina and I are actually on a number of calls with other states that are also funded on this same program. And so we're funded on what's called Component A because Iowa hasn't been funded in the past. But there's other states that are on kind of their next phase, and they're on Component B. So that's the other good news, is if we do a good job on this project, which we'll do, not only will it provide 5 years of funding, but we'll be well positioned to apply for Component B at the right time after that and to sustain the work. And so, again, this is how the CDC works to advance public health. And we're really excited to be getting their support and to improve the health of Iowans. And we want to target Iowans that need it the most. So our target population is rural counties and rural populations that really are underserved and that we have trouble reaching. And I know that's true for all of us, that we want to figure out how do we reach them, and collectively, collaboratively, we will be able to do that. So that's one of the goals, is to target the disparities and the populations that need it the most. But again, I was highlighting that we do network with many other states. They recommend sharing of best practices, including like how do we promote clinical referrals, and how do we promote technology integration with our system. And the system we have in place with the hub that Trina's built is through Workshop Wizard. And I can tell you from our conversations with other states that we are ahead of the curve, I'll say, by a long shot, or by a long way, in that we have a system in place and we can take referrals and get people into evidence-based programs. And so these are recommended strategies of this bidirectional feedback that we're trying to establish through the hub, that we get clinical referrals into the hub, referrals to a community-based program, and then back to the clinicians. And so that's really what we're trying to create here. And it's echoed in all these national recommendations. I guess the third update is that NACDD also guides us through what's called the National Arthritis Council. And it's somewhat the leadership team of all these other states. And it's exciting to announce that Trina was just nominated to be the chair of this group nationally. So kudos to Trina. And so we will be very well represented at the national level. So Trina will be leading the charge on how other states could build hubs and how we could harmonize our work together. And so again, that's exciting that she'll be leading this effort. And she and I have both been kind of shadowing this group for a while. So we kind of know what some of the other states are doing, and also why we're ahead of the game a little bit. And so we're excited to kind of keep Iowa at the forefront and take a leadership role. And we think we can do that. Any other thoughts there, Trina, about the council or the background? Or
No, that's really good. Just looking forward to, again, giving voice to Iowa on this council. So hopefully we'll even be able to receive support through that too.
Yeah, this other group that we work with is called an evidence, or arthritis evidence, or what is that group called? The advisory board? What is that one?
Advisory board, yep.
It's another group, but this group includes national panels of physicians and other partners, and they're actually looking for one state to be a model state for evaluating the NACDD model of how they're going to integrate with clinicians and community-based organizations. And Trina and I were asked to comment about whether Iowa would be a good choice. And we both said, yes, we think we could be a good candidate. So there's a chance that Iowa would be selected to be the pilot for arthritis programming in the country. There's a couple other states that have some advantages too. So it remains to be seen if they'll pick us or if we want to be picked, but it'll be pretty exciting regardless, because we're on a very good trajectory. So All right, so I wanted to again give you that background, and again do a little bit of cheerleading and make sure you guys all know that you're playing a key role in all of what we're doing. And it's not a project that Trina and I are doing on our own. We need and want all of your collective help. So we won't be so successful unless all of you are successful. And I really think that's a key thing that we should emphasize as we go forward. All right, so I do want to pull up some slides. So I have a little bit of an overview. Some of you have seen these before, but some of you have not. And so I'll go through them in a slightly different way. And this is where we'll pause and introduce the teams and the partners. So I'll pull up a PowerPoint slide here. All right, so you should see the slides now.
Yes.
Okay. So again, this is this 5-year program project grant. And so we're this component A project. And again, we will be seeing this title in the future as we keep going. But this is the model we submitted in the grant that our ISU Translational Research Network has been building capacity to do this very thing, to enhance and study how do we build effective public health systems. And so this is an interactive system framework, and it actually worked perfectly for the grant because our research team kind of is positioned to help figure out how do we study and promote best practices and get them institutionalized in systems, in other systems. And so the system we would work through is obviously the hub. And so the hub acts as a support system, but we also need a delivery system. And that's where ISU Extension comes into play. And so we will have many delivery systems, but the 3 entities here will represent the 3 key cogs in driving this project forward. And so it'll really be intricate loops working interactively over time. And as part of the grant, it was, again, a capacity building grant. And they actually had a requirement that we build capacity by funding 1.5 FTEs in our budget. So the majority of our budget is covering 3 different half-time people that will work with all 3 of our groups to kind of move things forward. And so I'm happy to announce Abby Caniglio has accepted the role as a project manager with our U-Turn team. And then Dawn, if it's, or I guess Renee, I think you're on the call. You're already a known entity here, and we appreciate your ongoing role with the hub as the support system person. And Dawn, I'm happy to have you on board officially to be our program liaison through Extension. So we will do introductions later, but Dawn, do you have any comments, or would you like to share a little bit about your background and why you took the position?
Sure. Thanks so much. I'm very happy to be part of this team. It's very exciting. I was introduced and to the opportunity from Dr. Sellers, and who could say no to working with a great team like this? I'm a human sciences specialist currently with Extension and Outreach. So this will just be enhance a little bit of the work that I do. And I feel like I have a lot of partners in place already that can help. And I come from a development background also. So thank you.
Yeah, it's perfect. So we're so happy to have you, Dawn. And the key role that you'll be able to play is the advantage of Extension. I think all of you know is that there's networks across the state in every single county, and but it requires a nurturing relationship that Deb and Dawn are really good at facilitating. So we have to ensure that each county feels it's meeting their needs and that they have other priorities as well. And that's true for our AAA offices as well. We know that there's many competing programs, and we want to make this consistent with what counties want to do in Extension and what AAA offices want to do to reach older adults. So all of it's designed to work with existing needs and constraints, not to add more burden. So we want to complement and support what's already going on.
And Greg, this might be a really good time for Renee just to make a quick introduction.
Yeah.
And say hi. So Renee, do you want to just say hi to everybody and introduce yourself?
Sure. Hi, I'm Renee Allard. I am the hub administrator, and I manage referrals that come into the system and get them into the hands of the navigators so that they can connect with resources, as well as working with organizations that are partnering with us.
Right. So I'm sure all of you guys will get to know Renee as this project goes along. So thanks.
Yep. And I apologize, Renee, I just figured everyone knows you already, but that's it is good that Trina re-announced you, and but you're so effective in what you're doing with the hub, and so yeah, that'll be a great fit. And Abby is a known entity on my team, but she's agreed to be a project manager as well. She couldn't join the meeting today, but she'll be starting in September. But we're excited to have Abby, and she comes with a lot of experience in, program leadership and health coaching in particular. And she also is an instructor in Tai Chi. So she'll be able to cross over and help on facilitating training of both Walk with Ease and Tai Chi and other programs. So we're excited to have Abby. So yeah, those are brief introductions there of and the 6 of us will kind of constitute a leadership team, and we'll kind of stir the pot and kind of keep things moving. But we, again, are going to rely on other sub teams to kind of help us operationalize the goals. And I'll kind of walk through some of that in the next couple slides here. But I did want to emphasize this. So if you were on our hub advisory call a few weeks ago, you saw me share this note here, but these are the 3 entity or components that we really want to emphasize in the project. The project will be coordinated with and through hub partners. We need your help in visibility, engagement, and collaboration. The second point is we want to emphasize continuous quality improvement. And again, that's what's embedded in system theory, system change. So it takes a long time to improve systems, right? So we wanted to use continuous quality improvement loops to improve what we do in delivery systems, the support system, and our translational system. So all of us will continue to improve what we're doing, and all of the organizations we hope will continue to improve. So every year in the project, actually, we'll try to summarize where we're at, and then make a new goal for the next year. And so one of our thoughts with this group is that we would have kind of an annual retreat, probably over the summer, right about now perhaps, where we say, what did we learn in this project from year 1? And then we'll use that to drive our programming in year 2. So we won't necessarily have lots of meetings with this full group, but we envision maybe an annual meeting where we come together and talk about, like, what is the overall project? How is it working? How can we make it work better? And so that's what we'll emphasize with continuous quality improvement. And that extends down to the delivery systems in YMCAs or in AAA offices or in extension offices. How do we build capacity there? And the third entity would be, again, focusing on sustainable and mutually beneficial strategies. And this gets at that we want to know, how do we make this work for you, for each of your entities, your organizations? So how do we fit it into your action plans and your strategic planning? That's what our goals are. So don't hesitate to help us understand those needs, and we'll try to meet them. So again, these are the 3 overarching goals of the project that I wanted to emphasize. This is an organizational chart that we actually built for the grant. And so we established a new subcommittee. So Trina already had the advisory group going, the community care hub, and a membership subcommittee. And as we started this project, we wanted a place where most of the work of the grant would get done. And so we're envisioning this implementation and translational research subcommittee is where we would talk about not just this grant, but also other ones. So as I mentioned, this is just the first of many grants that would come through the hub. And so some of the teams that we're thinking about needing for this grant, like a referral system and a connector system and a delivery system, all of those would be also primed and ready to go for other projects. And so our vision with this implementation and translational research committee would be that we would have these meetings to come together and share brief updates on the project. And we'd invite all of you to join those meetings as well if you're interested. They'll be every other month on Fridays at 9 o'clock. And so they would alternate the meetings of when the hub advisory group meets. So if you are open to having regular 9 o'clock meetings once a month on a Friday, you can join the hub advisory meetings 6 times a year, and then these implementation research meetings on the alternate months out of the year. And that's where most of the action of the hub work would get done. There's other subcommittees that you can get involved with, but we're envisioning that this is where a lot of this work would get done. And this just shows the current list of individuals that are involved, but it could include others. So it includes some of you on the call from our U-Turn team, from Extension and Outreach, from HHS, from clinical partners, and from the University of Iowa. So this is just a short list. We could add any and all of you to join this group as well. Any thoughts there, Trina, about that I'm missing about the hub? Or
Nope, I think you're doing great.
all right, so the next set of slides this was another key slide in our proposal. So it includes these different partners. So the referral partners on the left, the connector partners, the delivery organizations, which we have as AAAs, YMCAs, and Extension, but there could be others. So this just is a sample of like key cogs in the process. And then the ABBY coordination, we're listing CDSMP, Walk with Ease, and Tai Chi as 3 of the approved evidence-based interventions, but there could be others. And so we don't want to limit our work to these, but we do have to ensure that they are approved evidence-based interventions to kind of constitute our tracking within Workshop Wizard. So I'll break this model down a little bit more, and so we'll go through this in more detail. But I thought I'd show kind of how and why these different groups will work together. And that's embedded in this logic model. So they also required us to have a logic model. And again, some of you have seen this before, but we'll see it again. Those that have worked with me before on like our switch project, we're still using the same logic model we used in a USDA grant like 10 years ago, because the logic model worked as it's sharing good logic. And I think this one does as well. And so I'll break this down a little bit to show you how we're going to achieve what are called these performance measures and outcome measures. So the first part would be that delivery organizations and ABBY coordination would each do their own thing to help us move forward towards the goal of enhancing the delivery and expansion of ABBYs, and also providing statewide management of those ABBYs. And collectively, those two things would help us increase the availability and accessibility of ABBYs in the state. And so that's one of the performance measures in the grant that we have to document that we're working towards that. The connector partners and referral sources would also work and do their activities. So the connector partners would partner with state and local groups to reach and support individuals in rural communities. And we know that's a strategic goal for some of you, of how do we reach them? And that's one of the goals that we hope to help facilitate. The clinicians also want to be able to refer to evidence-based programs, but they need that to be easy, and they need it to be beneficial for them. And so we're going to try to facilitate screening and referral to support clinical referrals. Collectively, that leads to our second performance measure, which is increased referrals to ABBYs. So these two things of reaching rural groups and making it easier on clinical systems would help us do that. And collectively, you kind of see where this is going. These two performance measures would also help us reach our outcome measure, which is increasing ABBY enrollment resulting from sustainable strategies. And this is where we need to track this delivery of 6,500 people into ABBYs over 5 years. And we won't get there overnight, but we have built incremental goals of like 400 is our target in year 1. And then year 2, we'd have to increase that and increase that further by year 3 and 4 to reach that target of 6,500. And so that's one of the outcome measures that they'll be interested in. The second one is increasing the number who get counseling. So we would also work with the referral sources on how we can enable and support brief counseling by physicians to just encourage behavior change or enrollment in programs. And again, there's a number of different best practices that have been advanced in these national meetings about how to do that best and how to work with health systems. And we're fortunate to have Dr. Engebretson and Dr. Mulhausen on our team, and Liz Conroy to help us understand this referral process. So we've got great partners at the clinical level on this, and you'll hear from them in a little bit. But collectively, outcome measure 1 and 2 also then harmonize to help us reach outcome measure 3, which is to reduce disparities in those with arthritis. So we think that there's going to be more disparities, again, in these rural populations. So we need to emphasize how do we reach the people that need it the most. So that's the logic model. But now I'll walk through and let the teams we'll break through each of these teams and show a little bit about what their roles would be. So we've put all of you together in this one handout, and Trina can send this out to you as an update to ensure that we've got all of you listed in the right places here. But this will be a document that describes the different roles of these different teams as we move forward. So I might turn it over to you, Trina, to maybe highlight each of these groups, and then maybe each of the people can introduce themselves, and we'll see where that discussion goes.
Yep, I'd love to. So just going into a little bit more detail with our teams. So obviously here we have our referral source team. Here's where we will work on raising awareness about physical activity. Greg talked about seeing how we can work with physicians to increase counseling or screening, and then of course the referral into our ABBYs. And so those that have already volunteered, and those that are here today with us, I'd love to take a moment to introduce our team here. And Paul, Dr. Mulhausen is kind of our medical consultant for this project, and we're really excited to have him. He's got just a vast amount of experience working with this population, and hoping also that he, along with myself, I will work with him to help lead this group. So I don't know, Paul, if you have a moment just to introduce yourself, that would be wonderful.
Oh, wow. Thank you, Trina, for that. And thank you, Craig, for saying nice things about me. I'm Paul Mulhausen. I'm a geriatrician internist. Spent a lot of time in geriatrics working with people who have arthritis and mobility problems, and have developed a lot of interest in evidence-based interventions for pain management, as well as mobility and fall prevention. These days, I spend a lot of my time working in Medicaid managed care as a medical director with Iowa Total Care, but really looking forward to working with this group and seeing what we can do as a state to promote evidence-based interventions as a form of non-pharmacologic, non-surgical interventions to help people lead better lives, which I think are really important. So happy to be a part of the group and honored to be on the team.
Excellent. Thank you so much. That was a great introduction. And looking forward to working a little more closely with you, Dr. Mulhausen, and helping lead this team. And so some of our members in this team, I don't know if Tiffany, if you have a chance, if you want to go ahead and introduce yourself. Tiffany Conroy with Iowa Primary Care Association.
Yeah, thanks, Trina. So I am Tiffany Conroy. My role at the Iowa PCA is as an integrated health consultant. So I am focused on providing training and technical assistance and support to our network of federally qualified health centers across the state to look at whole person health. So the integration between behavioral health, medical care, and oral health. And so my focus area primarily is behavioral health. I am a licensed independent social worker and was in direct practice as a therapist for about 8 years prior to some work at our state public health department. And now I've been at the PCA for about a year. So really excited to be part of this team and to continue to grow my understanding and to support the initiative as well.
Excellent. Thank you so much, Tiffany. And then Dr. Engebretson from Primary Healthcare. Could you introduce yourself?
So primary health care is one of those federally qualified health centers that Tiffany was just mentioning. And I kind of got into this somewhat circuitously, working with Trina around more around diabetes and the DPP program. But I think, as Greg said in the introduction, this is kind of the first real world test or pilot of the whole concept. So, and arthritis is of interest to me as well. I'm a family physician by training, so it's kind of a perfect fit for a lot of my interests and experience and where we need to go with all of this.
Great. Yep. And I'll maybe introduce briefly Elizabeth Kashatka. She works in the McFarland Clinic here in Ames and has been instrumental in our efforts to test this initial referrals into the hub. And so we've been able, she's actually written scripts and things into Epic that have been received at the hub. And so it's an example. And so we wanted to have an EHR analyst on the team here. So she couldn't join the meeting, but she'll be a really great asset as well as a technical analyst of how do we enable that to in other systems. And I know if other systems aren't using Epic, we could figure out how to do similar things with other platforms, but building that integration is going to be really important.
Awesome. So this is our current referral source team. As you can see, we have really great individuals part of this, great experience. And hopefully if anybody else, if you have any other suggestions of who should be joining this group, you can share with myself or Greg at any time, share now, and or share in the chat. This is where, you know, if you have someone that you think, oh my gosh, would be just perfect for this group, then we will reach out to them and try to get them recruited.
I'll go to the next one here.
All right, so our connector partner team, and I'm not sure who is on here from this team, but I can sure speak to some of this group. So basically, these are the partners that we're working with. So they include kind of our SHARP partners, our social health access referral platform partners like Find Help and Unite Us, and then there's the information referral partners out there like your United Way 211, Iowa Compass. There's a department on aging with the AAAs. Any specific, oops, I have someone coming in now. So anybody specifically or any partners in Iowa that would help us connect individuals to community resources, whether it's through technology or through, you know, through just what their organization does as information referral connection. So we're really excited to continue our work with these individuals. The hub has done a lot to integrate with them. We're learning as fast as we can. We want to make sure that we create kind of an integrative system where our hub navigators have access to a number of resources and partners that when we have individuals that come in, we want to be able to meet unmet needs of connecting people to community resources and the programs that we're trying to get them connected to, and having more access to more partners and resources, the better, so we don't have any leftover unmet needs that way. So this is a very important team. I'll be leading the team, but some of the individual collaborators would be Liz with the Iowa Department of Aging. Would Liz be on this call right now that she can introduce herself?
Yeah, I'm on the call.
Okay, good.
Great.
Hello, everyone. My name's Liz Fridley. With the realignment, we are technically now the Iowa Department of Health and Human Services Division of Aging and Disability. I'm still getting used to that. But I'm the Health Promotion Director in that division, and I work with the AAAs to deliver, as they deliver health promotion and evidence-based programming, which includes those arthritis appropriate evidence-based programs that Greg mentioned via the Older Americans Act. So I work closely with the AAAs. Excited to be here. And I might just mention that I know it has been an effort or a focus of our state plan on aging to increase the capacity of the AAAs to be able to deliver these evidence-based programs. So it's really exciting when a grant opportunity like this comes along and just really aligns with the work and the goals that we're working towards. So thank you.
Yeah, perfect. Thanks.
And Liz, we'll try to make sure that we go back into all of our documents and get that right name. So yep. Thank you. Brian Feast, he is not, I don't think he's on. And I don't think so, but he is with Telegen. He's been a long-time collaborator. He's with Telegen, and he will be able to work with us and get us connected to Medicare population, actually with providers too that are serving our Medicare population. So there might be some overlap, Dr. Melhausen, with our team, with the referral source team there, but also just being able to help us disseminate some of that information, get people connected to some of those programs and services. So we're excited for Brian to be a part of our team. And then I'm not sure if Vicki with Find Help was able to make it or not, or our Unite Us partners. They will in the next meetings or any of our next meetings, especially our concentrated team meetings, they will be a part of that. Already have separate meetings with them, but just to let you guys know, we have already gone through phase 1 of integrating those SHARP partners within the hub platform to have for our hub navigators to have access to those community registries to look for not only programs but resources. So as you know, when we're connecting people to Abby's, that we also have to address their social determinants of health so that we can decrease as many barriers as possible to their participation. So just having that reach into all sorts of resources is really important. Our information referral systems, United Way, 211, Iowa Compass. Mike wasn't, I don't think Mike's on here. Mike Lightbody, but he will be in the future. They're a great partner. They will help us connect to the disability population along with Easter Seals, Tracy Kenninger. She'll be a part of this. And even Maggie Ferguson with Iowa Health and Human Services, they'll be part of it, all trying to help us connect better to the disability population. Of course, Workshop Wizard, our system, they are just great national partners and will continue to promote this work. So again, just like the other group, if you guys know of other connector partners in the state, I know there's some overlap sometimes because even AAAs are kind of considered, you know, that connector partner. So we'll have some overlap there, but if there's anybody else, please let us know. Next.
All right, we'll go to the next one.
All right, delivery organizations. So this is this is the people that are boots on the ground, doing the hard work, delivering the programs in our communities. And so we are hoping to do our best through this project to build their capacity and support them in being able to do this very important work. And so Dawn, I think this is where we were hoping, cross our fingers, that you would help lead this this area. So I think we've introduced ourselves already to Dawn, but if you have anything else to mention, just let me know. So we're excited for Dawn to kind of get started, and we'll be working and helping her support leading this team. Some of the others that are involved in the delivery organizations, again, like Greg said, we have kind of the kind of major partners that have very large reach across the state, like ISU Extension. So that would be Deb Sellers. Is Deb?
Yep, she's on.
Okay, Deb, would you like to introduce yourself?
Sure. Thank you so much, Trina. Deb Sellers. I'm an associate dean in the College of Human Sciences, also a professor and extension state specialist. My own particular area of interest is adaptive living for older adults and people with disabilities. And I've been an advocate for many, many years for evidence-based programs in cooperative extension, both within the state and nationally. So my role, as Greg talked about, is really to be that advocate and point of contact along with Dawn and Chris Seeger across the state for our extension system, recognizing that our local county offices have many, many partners that have been established for decades. And one of the most important things that Dawn will be doing is figuring out how do we leverage those partnerships that already exist and bring this forward as an opportunity. So pleased to be a part of the project and can't wait to move forward. Thanks.
And I'm not sure if maybe it might be a good time for Chris to say hi to the group as well. So Chris Seeger, if you have a chance to just say hi and introduce yourself.
Yeah, hello everybody. Chris Seeger, Community and Economic Development. It's part of Extension, and I direct the Indicators program over there.
Perfect. Thank you both for that introduction. I don't believe Wade was able to make it to this particular meeting, but he oversees the Alliance of YMCAs across the state. Definitely very interested in how they can be supported in the work they're already doing with Tai Chi and some of the other programs that fall within the arthritis appropriate evidence-based interventions. So they're really excited about how they can fit into this project, and we'll be working with them for sure. And then of course, with our project and our partners through the I4A, the AAAs, the Area Agencies on Aging, very important work that they do. They do a lot of evidence-based programming. We're really excited to have them involved. And I know Liz just made mention of them, but I'd love to introduce any one of them that are here today that are representing their AAA that we have here is Sunita. I think I saw Sunita enter. Would you be able to introduce yourself, Sunita?
Sure. Hi, I'm Sonita Oldfield Carlson, and I am the Director of Health Promotion and Evidence-Based Programming, Health and Home Safety at Milestones Area Agency on Aging, and we're serving 17 counties in South Central and Southeast Iowa. My role here is I'm the boots on the ground. I think that Trina is one of the sets of boots on the ground. Because I know it will take many of us. My role or my experience rather, is for the last 10 years, I've been delivering evidence-based programs in the communities that we serve.
Great.
Yes, very important work. And Sunita and I have done a lot through falls prevention too for the last few years. So excited that you guys are a part of it. I'm not sure if Kelly is on the call or not. Don't know if she was able to make it. Kelly? No. So Kelly represents the Connections AAA. And then I know we have Stephanie. So Stephanie, do you want to take a moment to introduce yourself with Aging Resources of Central Iowa?
Yes, thank you. I'm Stephanie Lobenz. I'm what am I? A nutrition and wellness specialist. That's my title at Aging Resources of Central Iowa. I'm a registered dietitian, so this fall prevention it's such a learning opportunity for me. I became like a coach in Tai Chi, Matter of Balance, Walk with Ease. Now we're doing bingo size. This has been so much fun for me. So thank you for letting me be a part of this. We cover Central Iowa, and yeah, this will just be fun.
Great.
Thank you, Stephanie. So as you can see, these organizations, ISU Extension, YMCAs, and the AAAs really cover a lot of ground across the state. So they're really important partners in this project, but we will be reaching out to other delivery organizations as well and supporting their work in over these next 5 years as well.
We'll go to the next one here. So I can maybe mention this one because Abby is going to be the new program manager in our network, and she'll lead this team on Abby coordination. And so I guess we created a similar structure here where, you know, Abby would lead the team, but we would have representatives from 3 of the groups that are leading the evidence-based interventions. So our team here at ISU is sort of the state net manager for the Walk with Ease intervention. And so I'll kind of represent that with Abby. And then we have Bailey kind of from the University of Iowa representing Tai Chi. So maybe you can say hello, Bailey.
Hi, yeah, I am Bailey, and I represent the University of Iowa Hospitals and Clinics. I'm their injury prevention coordinator for the trauma department, and I'm very, very new to my role. I'm only about a month and a half in, so I am looking forward to working with everybody.
Yeah, great. And then Allie Grossman leads CDSMP for Iowa Health and Human Services. So Allie, I think I saw you on too.
Yes, thank you very much, Greg. Hi, everybody. I'm Allie Grossman. I'm with Iowa Department of Health and Human Services. I'm a prevention and intervention section supervisor, but I coordinate the chronic disease self-management program, which we refer to as Better Choices, Better Health in Iowa. Excited to be here.
Yep. And again, like we said, we could offer other programs. So bingo size is another one, Stephanie. It is approved as an evidence-based intervention. So we could add bingo size in a team here. I have a license from the bingo size group in Story County. And so they have and I've trained our exercise medicine group to deliver bingo size more as a promotional piece for the students to, you know, reach senior living centers and things. But that's an example of another program that could be scaled up and studied and enhanced through our model. I guess the other announcements, so a couple goals here that relate to Tai Chi and CDSMP. So Tai Chi, one of the goals in year 1 is to do a landscape analysis of trying to figure out where Tai Chi is offered all over the state and harmonize that so that all those programs could be linked to the hub. And so that's one of the short-term goals in year 1. And then Allie, I know one of the goals for CDSMP is to, you know, increase the number of people that are trained in that. And so Trina just forwarded the advertisement or flyer for training. And so one of the goals we'd have in year 1 is also to facilitate training of others so that we can spread that. So any thoughts more about that, Trina or Allie? Or?
I don't know, Allie, if you want to mention your peer training coming up?
Yeah, I know it's coming up in like a month or something, right?
Yes, absolutely. So it starts in October. It's October and November. We do have a free virtual peer leader training for individuals who are interested in becoming peer leaders and facilitating better choices, better health in their communities. So yes, I think that's Tuesdays and Thursdays in October and November. It's for 2.5 hours over the course of 13 sessions. So if anybody's interested in that, send me an email. I can forward along that flyer and the application. And we are requesting that we get individuals registered by the end of the month. So.
And Allie, you and I chatted about you know, you right now are, correct me if I'm wrong, the only master trainer in Iowa. Is that correct, for Better Choices, Better Health?
I have a volunteer, so I am a master trainer, but I have a volunteer, Barb McClintock, who is also a trained master trainer. So for this next training, we're actually teaming up with another organization's master trainer to offer a combined training.
Well, I love Barb, and I should have remembered that. But you, correct me again if I'm wrong, a person has to become a peer leader before they can become a master trainer. Is that correct?
So that's a great question, actually. I believe that the way that it is set up now, correct. It has not historically always been that way.
Okay, because we, you know, as you can see, there's 2 master trainers in Iowa, and, you know, we want to see if we can expand that and add more master trainers. And so if, you know, again, we're talking about our ISU extension team and others, that if we want more of these programs, this would be a good time to get involved in this peer leader training, and we can expand from there. So thank you. Thank you, Allie.
Absolutely. Yeah. Thank you, Trina.
I just wanted to add one more thing about the Tai Chi. This is Bailey speaking, is that one of our benefits is that we're currently operating all virtually. So we're a good resource for, you know, people that can't make it into maybe a in-person class. They can be referred to me, and we can get them enrolled in one of our virtual classes.
Oh, that's perfect. Yeah. That's very similar to what Walk with Ease is set up. So I wasn't even aware of that, Bailey, that it could be virtual. That's great. And Walk with Ease, I'll just add a little bit, it is another similar training model. So through the project, we're going to be able to offer free training for, you know, any agent or leader that would like to learn the official delivery system for Walk with Ease. And it's delivered by the Arthritis Foundation, and there's a training course. And so I think, Stephanie, you're nodding your head because you were in that course. And so we trained Stephanie as a Walk with Ease leader. And one of the goals of the project is to scale that up and train 10, 20, 30 individuals in Walk with Ease, so that then they could deliver similar programs in their region and county. So we have a similar model set up there for train the trainers, if you will, of and through our U-turn team, we would provide additional support beyond just the online course, because as Stephanie can attest, it takes a little bit of extra logistics to figure out, well, how do you do this in practice? And so that's one of our goals, is to break down those barriers and make it easier for other sites to deliver very high quality programs in a manageable way. So that's good. That gets us through that for those 4 groups, but we have more. So we've actually formed a marketing group. So I'll let you kind of cover this one, Trina.
Yeah, I think this might be the last one. This is our last team, I think.
There's evaluation too, but that's the last one.
That's right. Okay, so the marketing team, this is kind of the network of partners that are going to really help us hopefully strategize in our messaging, to get individuals in the community more aware of and in touch with and understand some of these opportunities for them. So with the messaging, helping with enrollment and referrals, and I'm really excited about this team. I will take on kind of the leader position until potentially someone maybe in this group might be interested in helping lead this group of our marketing team, and really excited about those that are on the team. And I know a number of them are here today. So Katie Damon, I saw that you just came on not too long ago with Healthy Iowans. If you want to just take a moment to introduce yourself, that would be great. Not sure she's still here. Katie.
Yep, I'm still here.
There you are.
Hi everybody. My name is Katie Damon. I work with Healthy Iowans, which is part of HHS. Healthy Iowans it's a collaborative process. It includes both the health state health assessment as well as the state health improvement plan. And Liz mentioned earlier that activity and physical activity is one of the things identified in the state health improvement plan. So very excited for this grant opportunity and what that means for the state. So we're happy to be here, and we really want to help support and amplify messaging and the work that you're doing.
That's excellent to hear. Thank you so much, Katie. And then Sally with the Arthritis Foundation. Can you introduce yourself?
I'm Sally Stoniker, and I'm the Executive Director of the Iowa and Nebraska Arthritis Foundation. And I'm really looking forward to getting the word out and helping to get strategized to get the message out about all these fabulous materials. Thank you.
Thank you, Sally. Audrey with the Iowa Rural Health Association. We're really excited to be partnering with you.
Hi, yes, we're excited to be in this partnership. My name is Audrey Tronlom. I'm currently serving as the president for the Iowa Rural Health Association this year. I'm actually just about to go on maternity leave, so it won't always be me here on these calls, but we'll have somebody from our board to make sure that we're able to utilize our network to get the word out about this program. Thanks.
Thank you. And I wasn't sure if Angela was able to make it. Is Angela here?
I don't see her. No.
Okay, didn't think I saw her. Angela is part of the Iowa Falls Prevention Coalition. We're about 75 plus people strong, a number of different organizations involved, and she will help represent the Iowa Falls Prevention Coalition for us, and getting more, getting the word out and being able to increase enrollment potentially. And then again, like I said, we have some disability partners that we're working with: Easter Seals Iowa with Tracy, Iowa HHS with Maggie Ferguson, and then also Mike Lightbody with the Iowa Compass. Again, if there's there's probably a lot of other partners we could be engaging in this group. If anybody can think of someone that really needs to be on here, please reach out to us. And or put it in the chat, and we'll try to make sure we get them connected to this project.
Great. Then one more group, and I guess I can see this one because I'll be kind of leading this group. So it's our evaluation team. And as I mentioned, the CDC has a strong emphasis on documenting our progress towards our outcome and performance measures, and we're going to rely on some help from great colleagues here. So Allison Phillips is another colleague from our Translational Research Network. She'll join this team, but she's not on the call. And then Eliza and Olivia, I'll let you maybe introduce yourselves first.
Sure. Hi, everyone. I'm Eliza, also with Iowa HHS. I am our BRFSS coordinator, which is an acronym for our Behavioral Risk Factor Surveillance System. So our role, Olivia and she'll introduce herself in a second, is to provide some data related to this project about arthritis. The BRFSS is a interviewing system for across the state of Iowa. We gather a lot of public health data about adults across the state on a wide number of topics, but for this project specifically, we'll be looking at some of our arthritis information as some indicators in the evaluation portion of things.
Olivia?
And I'm Olivia Diggs. I'm the epidemiologist for the BRFS program, and I work closely with Eliza at Iowa HHS.
Yep. And the one cool piece here, so Chris Seeger, who introduced himself, will be involved with this team also, and he plays a key role because one of the aspects that I think was really innovative part of our submission is that we're going to take this data that comes out at the state level, at county level, and integrate it into the indicators program that Chris leads to produce reports that could go out to clinicians or regional AAA offices to show gaps in where the data, where we're needing more help, where we're doing well. So Chris, any other thoughts there?
I think that's pretty much on target. We're going to be trying a few things new and different with this, so we can have a targeted dissemination or product that can be disseminated both online and as a digital PDF or printed. So I'm kind of excited to get involved having this very targeted piece of information.
It's a perfect application, of the indicators portal that you've built over those years. So it's great. All right, so we are kind of near the end of the hour, but that's basically what we had hoped to get through in the project. So again, our logic model kind of covered all this, and collectively you see how all of our different partners are going to play a key role in that. And we've already kind of covered discussion and feedback along the way. So I think I might close that file, and then I'll just pull up our box note and cover a few other points here. So as I mentioned, we got through mainly what we wanted to do here of talking about the hub. We depicted the logic model, and we covered our teams and partners. And we've already kind of alluded to the fact that we need and want these teams to kind of be thinking about this over time. So when you leave the meeting, we don't want you just to unplug and say, okay, that's done. When do I have to join the next meeting? We'd love for you to think about, like, how would we operationalize these goals as a team and within these small teams? And Trina and I will kind of stir the pot a little bit and try to form some next steps with each of the smaller teams. But then what we'd like to have happen is some organic discussion and collaboration among all of partners, so that some of this starts happening between and through the meetings. And so we start, again, harmonizing all of our the work that we all do. And so we'll eventually manage and coordinate this and send out some other timelines, but we just wanted to have this kickoff meeting to kind of get things going. As I mentioned, we will have updates through the Translational Research Subcommittee. So if some of you are on that call in 2 weeks, it's on the 25th, we'll be introducing this project, but in a condensed format, because there's also several other grants that have hit. So one is the ISU extension got funded through the High Obesity Program grant that CDC also delivers, and Lindy Buckingham is the lead on that. And so she's asked to have U-turn involvement and hub involvement. And so we'll also be talking about that grant, and we'll also be talking about a new submission of an NIH grant that Trina and I think is right up our alley. So that meeting will, again, harmonize all the work that we're doing, but also create new opportunities for us to spread our wings a little bit. So later, I will form like a group list. So I might copy you all on an email, and it'll be like state arthritis team at iastate.edu, or some kind of generic list that you can email to, and you'll know that you're reaching all 20 or so of us with an email. And eventually we'll use that to reach out to you, but you can also email anyone through that same link once we get that set up. And this file here that I'm showing is how we'll kind of manage this, and it's in what ISU people call Sci box. Basically, it's a box folder, but branded with Sci. Anyone can be on these Sci box folders, and it's an effective way for us to share files and notes and things. And so I will add any and all of you to these folders, and then we'll be able to share not just notes, but files. And so the reason we use this kind of structure of meetings is eventually when we start having action items, we can nicely check off that we're meeting our action items and tracking them, or take other notes. And later, I already started some breakdown of our action plans. So these are, I'll just take a quick look or show through one of these. This is one of the action items or action plans that we had to submit to our CDC grant. So as part of the statewide dissemination, we had to break down, like, how are we going to do that? And so there's action plans 1.1.1, 1.1.2. And so each of these are really important. So we've kind of identified that, for example, this one's developing marketing materials. Well, that would be a perfect task within the marketing team. And so eventually we'll kind of break down and start thinking about what are our assets, what are our needs, what are our strategies for doing that. We'll do something similar, like I'll scroll down, to another one. This is where I reference the landscape analysis. So we have to break down, like, how are we going to get that done? Like, what are the procedural steps to actually do that big task? Same for CDSMP. That's where we want to recruit and train ISU extension leaders to be master trainers. That's written into our action plan. And so now our task is to identify, how do we do that? How do we get that moving forward? So yeah, I think I'll leave it there, Trina, unless you had any further thoughts.
No, I think this is good. It's top of the hour, and I think as we went through exactly what we wanted to, and the biggest thing was to just share who is all part of this team, and so everybody can see all the great expertise that we have working in this grant.
Yep. So thanks to everyone for joining, and again, we will be in touch. We will probably only have periodic meetings of this full group, but we wanted to have at least one full meeting to kick us off, and we'll break down and have small group meetings, but you'll know you're all connected to a larger entity here. So thanks, everyone.
Thank you.
Bye.
Thank you.